Hello, and welcome to More to the Story with Molly White. I am so glad that you joined us again today. We're going to have a very informative show for you today. We have a doctor that's coming to us from the UK who's going to be talking about the abortion reversal pills and procedures. And so you want to stay tuned for that. Again, like I always do, I want to give a kind of a warning out there. If you have small children in your presence, then you may want to put them in another room and distract them somehow, because this may not be a subject that you would want them to hear. If you've had an abortion in your past, this could be triggering for you, but we're here to provide you encouragement, to lead you towards help and healing resources. And if you're pregnant and you've taken these abortion drugs and you changed your mind and you don't want to do this, there is abortion reversal, and we will talk about that to help you. And of course, if you're pregnant and need help, we want to help you do that. It's always choosing life for your child is always the best choice for you and your baby. So I would like to introduce now my awesome, wonderful co-host, Mary Browning. And Mary, thank you for joining us again and bringing in your expertise.
Thank you, Molly. It's so good to be on with you again today. I'm excited about our who we're interviewing today, Dr. Dermot Kearney. Dr. Kearney is from the UK, as you mentioned, and I met him when I was in Utah at the Heartbeat International Conference, and he spoke about his experience with the abortion pill reversal and the adversity that he has suffered while in the UK, just trying to offer that simple type of medical care. So we are delighted to have Dr. Kearney with us today, and I hope he can join us shortly. He's going to talk to us about what has happened. And Dr. Kearney, can you just tell us where you're at in the United Kingdom?
Well, I'm actually from Ireland. You might recognize that from my accent. But I've been
Yes.
working in the United Kingdom, in the northeast of England, in an NHS hospital for the last almost 21 years. Having done my initial training in Ireland, and then I did some international training in cardiology in the Netherlands. I'm primarily a cardiologist, but also specialize in internal medicine, general internal medicine. And then in recent years, I took an extra interest in the abortion pill reversal treatment for women who seek this help.
So you are treating the heart, whether it's the physical heart or whether it's the emotional heart in some ways, aren't you?
That you could say that, I hope.
Mm-hmm. That's interesting. Can you tell us what your experience has been, how long you've been offering the abortion pill reversal? And let me back up just a minute.
Sure.
Can you tell our listeners what the abortion pill reversal actually is?
Okay, as most of your listeners and you would probably know, and certainly in the United Kingdom and in Europe, most abortions nowadays are carried out by drugs rather than surgical means. Surgical abortions still happen, but for example, in the United Kingdom, 90% of all abortions are now chemically induced or drug induced. It's not quite so high in North America, but it's a thing around 60, 65%, and growing year by year. And the drug-induced abortions are basically, it's a two-stage process where the mother takes, the first pill is called mifepristone, and that is a pill that's the one that concerns us in what we offer, because mifepristone blocks the action of natural progesterone. Progesterone is essential for maintaining pregnancy. It's called progesterone because it actually means progestational steroid hormone, and it's abbreviated to progesterone. So it's essential to maintain the pregnancy. And mifepristone competes for receptors. So progesterone has its effect. Progesterone molecules has its effect within pregnancy by attaching itself to receptors within the female reproductive organs to maintain the pregnancy. And mifepristone is an antagonist, so it blocks the receptor, so it gets in there before the progesterone can get there. And it's very powerful. So if you can inhibit the natural effect of progesterone, you can induce miscarriage. And that's the first stage of the pill. And then very often, and I'll come back to the figures in a short while, very often this will kill the baby, but that it won't necessarily cause the baby to exit or to leave the womb and the other products of conception. So a second drug is given 1 or 2 days later. They're instructed to give it 24 to 48 hours later, called misoprostol, which is a prostaglandin, and it causes the womb, the muscle in the womb to contract. So it causes intense uterine contraction and expels the usually deceased baby at this stage from the womb, along with the other products of conception. If the mother takes both abortion pills, as she will be instructed to do by the abortion industry, there's a 98 to 99% chance that her baby will die. It doesn't always mean that everything will be expelled, because roughly 6 or 7% there'll be incomplete abortion. The baby will be dead, but the products are still there, and the baby is still there, and they will have to subsequently have a surgical removal. And that's one of the serious complications of these drug-induced abortions, chemical abortions, is that there's incomplete abortion, which leads on to a further surgical need. But there's a 98 to 9% chance that the baby will die. A small number will still survive despite both drugs, especially if it's later in pregnancy, like 10 weeks, 11 weeks, 12 weeks. In the US, they're not allowed, or they're not supposed to give these drugs after 10 weeks. But many of these abortions now take place by telemedicine without any in face-to-face or in-person consultations. So there's no way of knowing when the abortion provider send the drugs by post or by mail that at what stage of pregnancy the mother is at. So there's a slightly higher chance of survival if it's in the second trimester or very late in the first trimester. Unfortunately, most of those babies who do survive will then subsequently undergo surgical abortion. So not many will survive to full term. If the mother takes the first abortion pill, mifepristone, the one that blocks progesterone, and if for some reason she decides not to take the second pill, but if she doesn't get progesterone, if she doesn't get any help from myself or people like me, there's a up to less than 20% chance, but up to 20% chance her baby might survive. So that's so with both pills, there's a less than 2% chance. With taking just the mifepristone, but not the second pill, there's less than 20% chance that the baby. Again, it'll depend on the stage of pregnancy. If she takes the first pill, if she changes her mind, doesn't take the second pill, and if she seeks promptly help from the abortion pill reversal network, and gets progesterone treatment, because that's all we give is natural progesterone to counteract the effect of the mifepristone. So if she gets that treatment promptly before serious bleeding, severe cramps have started, there's a greater than 50% chance that the baby will survive. I put those figures as being, they're very conservative figures. In the UK, our experience has been 50 to 55%. In North America or in the United States, the success rate is about 65%. The reason for that is, there's a few different reasons. The main reason being that there's a greater awareness in the United States. So very often mothers get this treatment very quickly. They change their mind, often coming out of the abortion clinic or as soon as they've taken the first pill. They know where to turn to. In some states, it's mandatory that the abortion providers have to tell the mother, if you change your mind, you can opt for abortion reversal.
Oh.
And that certainly doesn't happen in this country. So there's a greater awareness, and mothers will receive treatment much quicker. The second very important reason also why there's a higher success rate in the United States is that in many areas they will have access to emergency and urgent ultrasound examinations. So they can do an ultrasound to see, is the baby still alive, or has the abortion pill already had its effect, or is there an ectopic pregnancy? Is there a natural miscarriage that may already have happened? So they can determine if there's still a heartbeat, if the baby is still got a chance of survival. They can then go ahead and proceed with the abortion reversal treatment. We don't have that luxury here. We go on faith. If the mother contacts us, she's taken the pill, we can't get an emergency ultrasound, at least very, very rarely that might happen. So we have to just hope that the baby's alive. We get the progesterone treatment as quickly as we can, and then we try and get an ultrasound organized in the next 1 or 2 days. It may well be that some of what we consider to be unsuccessful attempts, the baby may already have been deceased before we actually got the chance to introduce. So we have a lower success rate, but still we've improved the success rate from less than 20% to greater than 50%. Now that may not sound a lot when you think, well, 50% are going to die or 45%, but there are very, very few interventions in all of medicine, including cardiology, very few interventions where you have a condition with a certain mortality rate of 80% plus, and you can reduce that mortality down to less than 50%. If in any other area of medicine this came to light, the whole world would be wondering, where can we get this treatment? This is sensational. We've we've saved so many lives by doing this. Like we get in cardiology, we get excited if a trial comes out with a new drug, and we reduce the mortality rate for a certain condition from, by 10% or by 12%. We think this is and it is. It's a great innovation. It's a great advance forward. But to actually reduce certain mortality from more than 80% to less than 50% is really remarkable.
Amen. Amen. Well, I have a couple of questions,
Sure.
Doctor. So, is there any known health risks involved with taking both the abortion inducing drugs? Has there been any research out there on that?
Of health risk with the abortion drugs.
Mm-hmm.
Well, in abortion in general, that there's lots of serious concerns that, of course, the abortion industry will deny. There's certainly, well, whether it's, and these are across the board, whether it's surgically induced abortions or chemically induced abortions, there is risk of increased risk of breast cancer. Not a huge risk, and not every woman who has an abortion will get breast cancer, but there is certainly a statistically significant increased risk. There's an increased risk of serious mental health problems, including substance abuse, suicide attempt, and actual suicide. There's a serious risk of future pregnancies having higher rates of prematurity, which can have unfortunate effects on the child. So that's across the board. Specifically for the chemically induced abortions, there we have a number of concerns that there is. Mifepristone is a dangerous drug. It causes bleeding, and that's what it's meant to do. That's what it's designed for. It's designed to induce miscarriage. It's designed to cause bleeding, to cause hemorrhage. Now, fortunately, most of the mothers who do undergo chemical abortions, while it is a very painful and traumatic experience for them, most of them don't suffer serious complications, but some do. And their hemorrhages are certainly not uncommon. We don't know exactly what the figures are, but what I can say from the United Kingdom, because the abortion providers don't report. In fact, they're not even obliged to report serious complications to the FDA or in this country to the regulatory authorities, and they don't follow up on these women. What happens in the United Kingdom is that 90% are done by chemical abortions, and the vast majority of those are done by telemedicine.
Right, right.
So a mother makes a phone call. They have a consultation which might last about 45 minutes, and there's a number of questions that they'll go through. But the person working for the abortion industry, they have no way of knowing what stage of pregnancy the mother's at. They're depending on her, first of all, telling the truth. They can't even determine or ascertain that she's actually pregnant. So it could be somebody looking for her daughter or her next door neighbor or her cousin or for somebody else.
Or a husband or his wife. Yeah. Mm-hmm.
Yeah. It's as long as it's a female voice that they'll take it as that this is a genuine call. So they've no way of knowing for certain at what stage of pregnancy it's at. And then the abortion pills are put into an envelope once they've decided, yes, they want to go ahead. An instruction pack is sent with it, a pregnancy kit, because they ask them to recheck to do a pregnancy test 3 weeks later. And then it's put into an outbox, and then they tick a box to say no complications, because once it leaves their office, they can then truthfully say there have been no complications during the consultation.
Yeah.
So they have no way of knowing what happens a week later. They don't even know if the mother takes the abortion pills. They don't even know if she took the first pill and then got abortion reversal. So there's no follow-up on these, unless the mother, for some reason, contacts them again. And what they tend to do, most of the girls that I've helped, in fact, almost all the girls I've helped, once they change their mind, the first thing they do is they go back to the abortion provider and say, I've changed my mind. I want to save my baby. And they're told, sorry, nothing you can do.
Yeah.
And then the vast majority probably just take it as that there is nothing they can do. So we don't know exactly how many women change their mind. Just as we get the tip of the iceberg, those who are courageous enough to then seek out to go on a Google search or to find someone that might be able to help.
Well, we're going to show a testimony here real quick, Dr. Kearney, and
Sure.
then we'll come back because I know Mary and I both have some more questions
Yes.
for you.
Mm-hmm.
Okay, Mr. Producer.
In the past 35 years, I've counseled thousands of women, including women who were trafficked, raped, and forced to abort. In the past 35 years, I've counseled thousands of women, including women who were trafficked, raped, and forced to abort. As one woman told me, I was told the abortion pill was safe. I was hemorrhaging. I didn't know I would see my baby. I was left alone in a bathroom while my boyfriend yelled at me. He forced me. Like me, she was told the same lies. We speak truth about the harm of abortion and speak healing to the broken hearts left behind. Our voices must be heard so our nation will know the truth about the lie of abortion. Thank you for listening to us.
Okay, so that's just kind of a sample of what women go through when they have a chemical abortion. And we have interviewed Dr. Kearney, several women on our podcast that experienced chemical abortion. I don't think we've had anyone that's experienced a reversal yet, but I would love to, have that opportunity to have someone like that on the show. But
We do have one. We do have one coming up.
oh, good, good, good.
Yes, we do have
So,
one coming up, so that's
well,
good.
praise the Lord, praise the Lord. But I had another question because I'm not a big pill taker. I'm not into the drugs, the pharmaceutical things. But is it too early to know, or would there be any chances that taking these abortion drugs would have any kind of long-term effects on the baby?
Did you mean if a woman, if she undergoes the reversal treatment, or just in
Right.
general?
After
Because in
she's
general,
already taken the
yeah,
mifepristone and
yeah,
then did a reversal, or even if the baby survived, because I do know of a woman who took these drugs and they did not work. So
yeah,
she's
good,
continuing on with the pregnancy.
yeah. It's a very important
Really know
question.
it to be any kind of health. Pardon?
No, the news we have is very good on that, and it's a very important question. Whenever I counsel any of the women, the mothers who come to me, if they don't ask that question, I insist that they do, because it's the most important thing that they need to address.
Mm-hmm.
For example, I first heard of abortion pill reversal in 2014, and I knew very little about it because there was very little information. And we were asked by one of the pro-life organisations in the UK to see could we help women. And I'm a member of the Catholic Medical Association, and we were asked at one of our council meetings by one of the pro-life leaders, could we help? Because women were coming to his organisation having taken the first pill and had changed their mind. And we didn't know anything. We never heard of abortion reversal. And 2012, the program was established in the United States, and we hadn't even heard of it at that stage. So there was very little information, but we said we'd look into it. However, we were all very skeptical because, first of all, we thought, is there much need for this? Because surely women don't change their mind. That was the first thing.
Mm-hmm.
Second thing was, is it safe? Is progesterone safe? Now, we know progesterone has been used in pregnancy for 50, 60 years without any unwanted effects for the mother, apart from nausea, tiredness, and sometimes headaches. They're the main side effects, but there's no serious effects for the mother or for the child if the baby survives. And then the third thing was, would it be effective? Our main concern about it was, if having been exposed to mifepristone, if the baby did survive, would there be any horrific congenital problems? So we were thinking in terms of thalidomide, the drug from the 60s, late 50s, 60s for nausea, vomiting in pregnancy, which is a wonderful drug for that, but caused very serious and congenital malformations in children. So we're worried about that. But as the years went by and we saw more and more stories and then small case studies coming from the United States, we saw that there isn't any increased risk of congenital defects. And the larger studies that are done looking at hundreds and hundreds of women, and now we're up to more than 5,000 babies have been born as a result of this rescue treatment. There isn't any increased risk of congenital problems for the child. In fact, figures suggest that it might be slightly lower risks of problems for the child, because with progesterone, you're less likely to have premature births by continuing progesterone for a period of time.
That's good news.
Good news.
It is good news. So mifepristone, the way I say it to the mothers, and it's the truth, mifepristone will either kill your baby or it won't have any long-term effects. And that's very important that the mothers understand that.
Amen.
Doctor, I have a question, because it really hasn't been an easy road for you to even be involved in the abortion pill reversal, has it?
Well, not everybody likes what we do. I don't know why. In fact, I mentioned it was this discussed at the Catholic Medical Association. Once we saw the evidence coming through from the United States, and then I went over, was in 2018. So this is 4 years after we first heard about it. 2018, we were approached by a second pro-life organisation, a wonderful lady called Claire McCulloch from Good Counsel Network in London, and she pleaded with us. She said, "Please, more and more women are coming to us almost every week looking for help. They've taken the first abortion pill. They want to save their babies. What can we do? We know that there is a treatment. Can you try and establish a service?"
Mhm.
So I went to. I promised her I would, and at that stage, more information had come through. I went to the United States. I met George Delgado, who was one of the main pioneers of the treatment from California, Southern California. I went to a number of talks on the issue. I read everything I could possibly find, both negative and positive comments from all sides of the story. And then we decided, yes, we were going to establish this service. At this stage, I was the president of the Catholic Medical Association in the UK, and we decided as a body that we would try and do this in a proper fashion. We would write to all of the authorities, tell them all the evidence that we had accumulated, and ask them to try and set this up as part of the National Health Service, basically. So we wrote to NHS England, we wrote to the Royal College of Obstetricians and Gynecologists, we wrote to the Royal College of General Practitioners, saying how wonderful this treatment was, how great a need there was. Women were coming looking for this treatment, and the responses we got were very disappointing. They were very negative. The most hypocritical of all, actually, the worst of all, was from the Royal College of Obstetricians, who said, "Oh no, we do not recommend any unlicensed medications." Now, misoprostol, the second drug used in abortion, is not licensed for abortion. It's licensed for management of peptic ulcer disease, but not for abortion. And yet they're very happy to recommend and to prescribe that. Also, methotrexate, which is an anti-inflammatory drug, it's used for rheumatoid arthritis and some other chronic inflammatory conditions. They highly recommend that for the medical management of ectopic pregnancy. So we wrote back to them thinking that maybe they, in an oversight, they had forgot to recall these weaknesses in their argument, but we got no reply from them. So we wrote a third time after we had contacted the General Medical Council. Actually, we wrote then to the General Medical Council asking a question. Now, we know that the General Medical Council is a regulatory body. It doesn't give clinical advice. But we asked them, which is a very important question, what should a doctor do if a woman who has taken the first abortion pill changes her mind and comes to the doctor saying, "I want to save my baby, can you help?" So what are we supposed to do? And they gave us a reasonable response. They said, "Well, we can't give clinical advice, but what we can say is that every patient in all situations is entitled to know all of the treatment options available to them, and they're entitled to withdraw their consent from any management strategy at any time during their management." So we put two and two together and said, well, they've basically withdrawn their consent for abortion. They want to save their baby. Here is a treatment which is, we know to be safe, we know to be effective from the information that was already coming from North America. So let's offer this. So we set, myself and another doctor, Dr. Eileen Riley, we set up a service. We contacted the Heartbeat International, the company, the organization that had that wonderful conference in Utah. We registered with them because we know that a lot of the mothers who seek help, they go on Google and they find abortionpillreversal.com, and it puts them through to Heartbeat International, who then have contacts all around the world, mostly in the United States, but all around the world. And once you're registered and you understand the protocols, and they're happy that you're willing to follow the protocols properly, they will put mothers in contact with us. So that's how I got involved in. So 2020 was the start of my involvement.
2020. So what has happened since 2020, Doctor? Because
2020, myself and Dr. Riley were very happily offering this service, but a slightly higher than 50% success rate. In our first 12 months, we had 32 babies between the two of us that we saved. It was heartbreaking when mothers were doing really well and then had miscarried later, and some of them were possibly natural miscarriages, because some of them, once you get over the first 2 weeks, if you haven't miscarried by that stage, after mifepristone, it's well out of your system. So most of the mothers do very well if they can get over that sort of 10 to 14 day period. But we did have some later losses, which is always very heartbreaking. But on the other hand, I used to get very, very upset, and I had lots of discussions with Dr. Riley. She's an obstetrician. And I said, it's really hard to know. Sometimes I wonder, is it worthwhile continuing this? It's so emotionally. And she said, even if you save one life, it's worthwhile. So we saved 32 lives. Now, some of them probably would have survived even without the progesterone, but the vast majority wouldn't have done. So at least 25, 26, 27 babies were saved that otherwise would not have survived without progesterone. So we were doing this very happily from mid 2020 up until I know the dates very well. The 28th of April 2021, we both received simultaneously an email from the GMC to inform us that serious allegations had been made against us that could amount to charges of professional misconduct, that we were charged with a number of offences or potential offences. And then against me, there was 10 specific charges: that we were using unlicensed, unregulated medication, that we were imposing our pro-life beliefs on vulnerable women, we were imposing our Catholic Christian beliefs on vulnerable women, that we were not following the recommended NICE guidelines and national guidelines on abortion provision. We weren't providing abortion. So there was 10 specific allegations against us, and we had to. Both of us were ordered to attend a tribunal. Less than 2 weeks later, on the 12th of May, we had to attend a tribunal called the Medical Practitioners Tribunal Service. Didn't give us much time to prepare for because it was also weekends and bank holiday weekends. But that was on a Wednesday. I had to inform the various pro-life organisations that we could no longer provide this service because we were under investigation. And we didn't know that the investigation had actually started in January. We had been reported by Mary Stopes International. That's one of the main abortion providers in
Oh,
the
yeah. Mm-hmm.
and the Royal College of Obstetricians. They were the two main complainants against us. They had started the process in January, and lots of conversations and correspondence had gone on between the GMC and these complainants over the subsequent months, and they were trying to find evidence. Even though they couldn't find any evidence, they put forward these allegations. So that was on the Friday. By the Friday morning, a wonderful group called Christian Concern, led by Andrea Williams, who's their chief executive. She had heard about our plight, and by Friday morning she had organised a Zoom meeting, because this was in the middle of COVID, with her top legal people in Christian Legal Centre and myself and Dr. Riley, and they decided they were going to fight this. Because our initial reaction was, well, it's the General Medical Council, complaint has been made, there's nothing we can do, we just have to see what happens. But she pointed at the camera. There's a wonderful lady, and she said, "No, this is unjust. We are not going to accept this. We are going to fight this, and we're going to win." And I thought, well, okay, we'll see what we can do. But so she got her legal team together, and they, within a matter of days, they had an expert witness who was a fellow of the Royal College of Obstetricians, who actually performs abortions. He's not Catholic, he's not Christian, but he looked at the evidence, or the lack of evidence. He looked at the allegations, and he thought, this is ridiculous. He thought, well, there's nothing wrong with what you're doing. It's a legitimate service. There's evidence to support it. You're certainly not imposing anything on any of the women. So he was happy, and he wrote a very supportive, strong witness statement for us. We got witness statements from a number of the mothers. Now, I wasn't allowed to be involved. I just had to ask them, is it okay if I pass your contact details to legal people who want to ask us some questions? Because I could have no influence on their decisions. And we could have got 40, 50 statements, but we got 10. We got 10 different ones. We got some from mothers who had their babies and were obviously very delighted. We got some from mothers who were waiting to, like, the treatment had been successful and they were waiting to have their babies. We had some from women who, unfortunately, the treatment hadn't worked, but they were so grateful that somebody tried to help them in their time of need and distress. And we even got 2 statements from women who decided, for various because only about 2/3 of the women that contact us actually go ahead with treatment. So we got 2 from women who were just very happy that somebody was prepared to discuss all of the options with them and offer this if they wanted to go ahead.
Really provide real health care. That was real health care.
Real
I
help.
tell them the truth, basically, where they had been told, or at least the truth had been withheld by other persons.
Mm-hmm.
It's okay for the abortion industry to lie and only give you one option, and to not give you the truth that there's reversal or there's care. And of course, when we step in and try to help women, then the abortion industry considers it a threat against their profit line, and so they are going to come after us. But I appreciate not only you doing this, but thank God he gave you that connection with that legal firm, and that they came to your defense. And I guess it was ruled in your favor.
Well, no, absolutely not. We went to our tribunal on the 12th of May, and to our astonishment, even though we had accumulated all this evidence, they said, "Oh no, we're not going to look at the evidence. We're only looking at the veracity of the allegation. No, we're not looking at the veracity of the case. We're looking at the allegations to see are they serious enough to warrant a further investigation." And they looked at the allegations. They ignored all the evidence. So we basically wasted our time. So they said, okay, so they sentenced us to both of them. I was first. I was in the morning. Dr. Riley was in the afternoon, but we both got the same sentence basically. In my case, it was that I was not allowed to prescribe, administer, or recommend progesterone for abortion pill reversal.
Wow.
But that was, they looked on that as being lenient because the GMC actually, they wanted us to be completely suspended. That means not allowed to do any medical work whatsoever, but you take away our livelihoods for 18 months. That was the maximum sentence that could have been imposed. So they wanted that, but the tribunal thought, well, that would be a bit disproportionate because there had never been any complaints against either of us for any other reasons in medicine. So, and also this was also in the middle of COVID when they were trying to get doctors back from retirement and back resurrect them to meet the demands of the service because there was such a shortage of personnel to deal with the COVID crisis. So they thought it would be disproportionate to put away two experienced, caring physicians completely and not allowed to do any medical work. So we were allowed to do in my case, my normal cardiology and other medical. I wasn't allowed to do any charity work. So they said I must not do any charitable works. I must not do charitable medical works as a doctor, and I must not do any voluntary work as a doctor or any private work without written permission from the GMC, which would have been taken. So they just wanted to make sure that we didn't provide this service in any way. So and then
how corrupt and evil that is. You know, it just is a blatant show to me that they really don't care about women. They don't care about women's health. They don't care about mothers and motherhood. They just have an agenda, and their agenda is abortion. Period.
The GMC say they don't have the agenda. They're there for the protection of the public against bad doctors.
They have an agenda. They have been influenced. You know.
Well, they have friends maybe in the abortion industry, but
right. They've been influenced, or they would not come down with a decision like that. You know.
It seemed a bit harsh to me, and I must say, my first reaction was anger and frustration. But we soon realised, as Andrea Williams said, we're going to fight this. We knew it wouldn't be an easy ride. We'd have to fight this. So now the maximum sentence, or the sentence was imposed, but by law it has to be reviewed every 6 months. So in the meantime, we got to work, getting more witness statements and preparing our case for the next 6 months, hoping that this would come to an early end. Because if it went to 18 months, then they would extend it another 6 months, and they would just keep it going on to perpetuity until. So at 6 months, the decision was made. Oh no, we're not going to look at any of the evidence again. At which stage, my legal representative from the Christian Legal Centre, Mike Phillips, he threw up his hands in exasperation and said, basically called them a kangaroo court. He said, "We're going to take you to a proper court." So we did that. So we had a little meeting, and we decided we would take them to the High Court, like take it out of the hands of the medical people and take it to a proper civil high court, similar to your Supreme Court. And we put forward our petition, our case, the end of September, start of October 2021. And I thought it would be a long delay because there was a lot of backlog with COVID. Courts weren't meeting regularly as they had been before. But surprisingly, we were offered a full hearing on the 24th of February 2022, which was pretty good. The GMC contacted us several times to say that they had not managed to find any evidence to support the allegations against us. They had not managed to find any expert witness to support the allegations against us. Eventually, after Christmas, so in late December, early January, they say, "Oh, we have managed to get an expert witness, another fellow of the Royal College of Obstetricians, who again presumably does abortions. I'm not sure." But surprisingly, even though he was on their side, his report was very supportive towards myself and Dr. Riley when she got a separate report, but it was more or less the same. again, he saw there was nothing wrong with the service we were offering. There was evidence to support its use. There was no evidence that he wasn't allowed to see any of the statements from the women, by the way, or from our expertise. He was only allowed to look at the allegations and whatever other piece of evidence about the abortion reversal that was available to the public. So he wasn't allowed to see what the women had said about me, which actually had me in tears. I didn't realize it meant so much to them until I read some of their statements. But even without seeing those, heart-rending statements, he felt that there was no evidence that any pressure was being put on any of the women. So his only concern was that there was an element of money. Now, my services are free. I don't charge anything.
Wow.
It's a pleasure and an honor to do it. But some of the girls couldn't afford the drugs. Now, the drugs are not expensive. They're for 2 weeks of treatment, because I always got 2 weeks at a time. So, because I didn't want them spending money on something that may not work. So I had to tell all of the mothers who wanted to go ahead with the treatment that, by the way, this is not a normal NHS treatment. So unfortunately, the drugs have to be paid for, because they're used to getting treatment for free in the UK. And they say, how much does it cost? And I said, well, for 2 weeks, it'll be about £20. London might be slightly more expensive, £20-25, which would be about $40. And the majority would say, that's fine, that's no problem, I can manage that. But some couldn't. Some were so poor that I don't get paid till next week, or I don't get paid till 2 weeks. And I would say, well, if that's the only reason why you can't go ahead with the treatment, but you really want to, then I'm happy to pay for you. So in some cases I paid. Now initially I tried to pay the pharmacist, but that partly wasn't acceptable. It had to come through the patient or through the client. So I had to put money into their accounts that they would then give the pharmacist.
Oh, wow.
So that was the only thing that concerned their expert witness. He was a bit concerned that was I bribing these women? But we were able to show that we weren't actually paying the mothers, we were paying the pharmacy, but it had to go through the mothers. And once we pointed that out, he was happy enough that
that's
our explanation was
so awesome.
valid.
Well, Doctor, I want to thank you. I just want to thank you for standing in the face of this adversity. And I think when you were in Utah, I can't remember, it was a Tom Petty song, right?
Yeah, I won't back down. I won't
I
back
won't
down.
back down. Yes.
Yeah, we're going to have that as your
Brown.
theme song today. Yeah. And we forgot about that.
Yes. And so what was the final outcome then? If the best they could come up with was with a witness that said what you were doing was fine.
Yeah. So we were due to go to court on the 24th of February, and 6 days beforehand, I got a phone call from my solicitor, from Mike Phillips, from the Christian Legal Centre, to say, have you heard the news? They've dropped the charges. And I hadn't heard anything. I said, are you sure? And he said, no, they've dropped it. We just received news. And half an hour later, I got an official confirmatory email from the GMC to say that their case investigators had considered all of the evidence, had considered all of the statements, and the way they phrased it was there was no prospect of finding any evidence to support the allegations that had been made. So the case
no prospect of finding any evidence.
Yeah. Now, interestingly, they only issued that to me. Dr. Eileen Riley, who was my other partner in crime, she didn't receive exoneration for about 2 months later. The reason for that was that Eileen decided she was going to go with a secular legal representatives. She was advised by someone, oh no, don't touch the Christian side, because they'll turn it into a religious issue, so you stick with the secular one. So she did, but their attitude was, unlike Christian Legal Centre, who said, no, we're going to fight this. She was advised, keep your head down, don't challenge this. We know you're guilty, but let's aim for damage limitation. So don't challenge it, basically. So interestingly, so the GMC didn't drop the charges against her for another 2 months.
Wow.
Because in my case, they would have had to go to court. So if you picture what would have happened on the 24th of February, if we'd gone to the court, they would have put forward the allegations, and then the judge would have said, okay, can you present your evidence? And all they would have been able to say was, well, we don't actually have any evidence, Your Honour, but we don't like what that guy's doing.
Right.
So that's literally all they would have had.
Right. Yeah.
So that really wouldn't stand up in court, whereas we had just witness statements from mothers who had availed of the service. We had expert witness statements that were very supportive of the service. So we would have won very easily. So they had to drop.
That's what I was. Yeah.
They couldn't risk the embarrassment or
Yes.
the cost.
That's exactly what I was thinking. Mary's an attorney, so so she's probably really understanding all of this. But that's what I was thinking. They had to drop their charges because they had no supporting evidence, and they would have been raked over the coals in court. And I wish they wouldn't have dropped their charges. I wish they would have been raked over in court, so that the general public can see that, they don't always, the medical establishment doesn't always look after the best interest of their patients. They look after the best interest of their agenda, or to protect themselves. I'm sorry. I'm kind of just really, I'm not a big fan of the medical industry. And it started with my first abortion when a doctor told me it was good for me. And so that kind of broke my trust in the medical industry. But then I've seen evidence all along, and COVID kind of really tapped it all off, that they have an agenda and for the patient. But certainly glad that's happened for you, and praise God for you, Dr. Kearney, and your compassion for women. That touches my heart. I want to just real quick, because we're going to have to go. I want to show one more testimony, Dr. Kearney. I don't know if you've I've seen too many of these, and then just kind of encourage our viewers that there's hope, that if you've taken these drugs, there's hope that it can be reversed if we catch it in time. So go ahead, Mr. Producer, and play our testimony.
I hadn't been very educated on anything in regards to pregnancy or anything like that. And so I was pretty afraid. And so was my husband. And we didn't have his family. And then my family, my mom is a doctor. And I felt like she would be upset with me because it was too young. I was too young, and I had just graduated and didn't have a career or anything. And so looking for help, there just across from our church, there was a pregnancy sign that said pregnant and need help. And it happened to be a billboard for a Planned Parenthood. And so I called the number right away and ended up in their office. And at that time, I didn't really say I'm looking for an abortion or I'm looking for a solution.
Alternatives or
Right. I was just looking for, I guess, more like counsel or support in my fear. And so when I called the number and ended up there, about a week later, they walked me in, and my husband came with me, but he wasn't allowed to come back with me. And so they took me back into a room and did a vaginal ultrasound, and they confirmed that I was 4 weeks pregnant, about 4.5 weeks, I guess. And so she quickly said, yes, you're pregnant, there's a heartbeat, and then shuffled me out of the room. But at that time, she didn't show me the ultrasound or give me any information other than tell me, yes, I am pregnant. And then she moved me into the next room. And I told her that I was afraid and that I was just starting my interior design career. And she said, well, it's really nothing at this point. It's just tissue. And so we do offer a pill that will take care of this. And it's perfectly normal. It's safe for you. It's not a big deal. And so me being innocent and not really knowing, and also not having my husband there to talk about it, I said, okay, well, it sounds safe. It sounds fine. And so then she moved me to another room to give me more counsel about this pill, which really was more like, this is how much it's going to cost, which is $400. This is, you'll just have some cramping, and then you'll move on with your life. And then you'll take the second pill when you get home. And so I did innocently that day take this pill that this nurse had promised would take away all my fears and all my anxiety over this. And after that, I walked out with my husband. We went home. Life seemed normal. And then that night, I was then told to take the second pill. And so I took the second pill. My husband was in bed at that time because I think it had to be within a certain number of hours. And this was the RU 486. Is it 486?
It's my... RU 486 is a common name for it, yes.
Yeah. And so then when I started the second pill, I started getting excruciating pain. And this is when I wasn't told what was going to happen. Nor did I understand that my body was going to be sent into labor. And so I was on the bathroom floor crying in pain, cramps, like what is happening? Because I'd never, again, very young, not knowing what's happening to my body. I started passing big blood clots and just like crying out in pain. And eventually I passed what I thought was my baby, which at that point, more as like a healed woman now, I can look back and see that it was my baby. At that point, I didn't know what was happening. It was more just like, what is happening? But it was almost as if the mother inside of me knew that life was being passed.
Okay, yes. So anyway, it was a little bit longer than I was expecting, but that's just kind of the experience and a common experience that women have after taking these dangerous abortion drugs, because they're not being told they're going to, their baby's going to die, and then they're going to go into really hard labor and past blood clots and even hemorrhage, possibility of hemorrhage, the possibility of sepsis, and all of those kind of things. So, and we wanted our audience to kind of listen and hear that testimony, because the abortion drug is dangerous. It's dangerous to you. It's going to kill your baby, and you have no control over what your body's going to do and how it's going to react. And if you've taken that pill and you're still, what, Dr. Kearney, within a couple of days, or how soon?
The sooner the sooner the better. But up to 72 hours, as long as the mother hasn't already experienced severe hemorrhage, severe cramps, even up to 72 hours, there's still a chance. It's still worthwhile going with the abortion reversal treatment for that. But obviously, the sooner it's given, the better. Within 6, 8, 10 hours, there's a higher chance of success than 24, 30. In the UK, our average time from the mother taking the first abortion pill to actually getting her progesterone is about 25 hours. Whereas in the United States, it's probably less than 12 hours, at least in many of the states. So they will have a higher success rate with that. But even up to 72 hours, it's still worthwhile if there hasn't been serious bleeding.
And that would be before the second set of pills are taken as
But
well?
yeah, if they're taking the second set of pills, at least as far as we know, there's unlikely to be any benefit in taking the progesterone. I have done it on 2 occasions where the mother didn't tell me that she'd taken the second pill, but she was still hopeful that she might. But not surprisingly, the treatment didn't work in those 2 cases, because there's a 98 to 99% chance that the baby's going to die if both abortion pills are taken.
Okay.
So, doctor, I guess one of the main things our listeners, one of the main takeaways might be that if you've taken that first abortion pill, if you've taken the mifepristone and changed your mind, you can call that heartbeat hotline number that's running across the screen here and get in touch with a doctor.
Or if they go on abortionpillreversal.com, that will get them immediately to the Heartbeat International website, and the helpline comes up flashing pretty quickly.
And so no matter where in the world they are, or for the U.S., no matter where in the country, that number would get you to a doctor that could help get the progesterone, which is just that strong, would you call it a pro-steroid hormone?
Progestation steroid hormone.
Progestation steroid hormone.
Progestation. So progestation, supporting pregnancy.
So it's just enough. The goal would be to override the mifepristone and get the body back into its natural position.
Yes, just as mifepristone competes for progesterone and blocks it, so if we give enough progesterone, that will compete with the mifepristone. So it becomes a battle between the two hormones, the mifepristone or the progesterone. The progesterone's the good guy, mifepristone's the bad guy. If you can get more of the good guy molecules in there, they're more likely to bind to the receptors and prevent the bad effect of the mifepristone.
Awesome.
And the sooner the better. The sooner after the first pill, the better.
The sooner the better. So that's what we want to encourage anyone who's listening that you maybe taken this first set of drugs and you've changed her mind, the sooner you contact someone, the better. Like Mary said, we have a phone number down there. There's a website that you can contact, and of course, we're praying for you and hope that you and your baby survive this. But most of all, we hope you choose life. Choose life, and you can avoid all of this trauma, all of these medical issues, and you'll be a whole lot happier.
Yes.
My personal opinion, but I think we can all agree to that. Well, Dr. Kearney, thank you so much for calling
Thank
in. I
you.
know it's late over there in the UK, but boy, God bless you. Thank you for what you're doing for mothers and for babies, and for standing strong against all the attacks that have come against you. We know it's not over. Whenever we defend life and stand strong for mothers and babies, we always come under attack, but that's okay. It's a cause worth fighting for and a cause worth educating people about. So thank you for joining us. Mary, is there anything you wanted to say before we go?
I just want to say we thank you that you did not back down.
Yeah.
Good.
You
Yes. Yes.
stood strong, and we appreciate that. And
Yes.
and we thank y'all for tuning in and listening to More to the Story with Molly White and my famous and most popular co-host Mary Browning. And we look forward to seeing you again next week. God bless you.
Yes. Thank you,
Bye bye.
Dr.
Thank you.
Kearney.
God bless.
Thank you, Molly.
Thank you.